Good afternoon. Peripapillary retinal nerve fiber layer thickness by OCT in myopia. Myopia is most common form of refractive error causing ocular morbidity worldwide. It is well recognized that myopic eyes are more susceptible to glaucoma. Why this study? Myopia can obstruct the results of structural and functional tests used to diagnose glaucoma. So this study aims to achieve this understanding by determining the critical limit to which retinal nerve fiber layer thickness is affected by myopia, and this will help to differentiate the retinal nerve fiber layer changes in myopia from that caused by glaucoma. Objective of my study is to assess the peripapillary retinal nerve fiber layer thickness in myopia severity group using OCT. Methodology: study design is a hospital-based cross-sectional study. Duration is 1.5 years. Sampling method is non-probability sampling. Study population is patient attending the ophthalmology OPD at Government TD Medical College, Alappuzha. Sample size is 204 eyes. Inclusion criteria is spherical equivalent more than or equal to 0.5 diopter in myopia group. Age group between 18 to 40 years. Exclusion criteria is peripapillary atrophy extending more than 1.7 millimeter from the center of the optic disc, which interfered with optic disc cube measurement. Prior ocular or refractive surgery. Patients suffer from any ocular or neurological disease that causes thinning of RNFL, and patients suffer from any pathological ocular or neurological condition that affect their vision. Study variables are visual acuity, fundus examination by 90D, automated refraction, OCT RNFL assessment by Cirrus SD-OCT, axial length by A-scan. Results of the study. Mean in my study population, mean age group is 27.5 years, and the 47.5 are females and 52.5 are males. By comparing the relationship between the severity of the myopia and RNFL thickness, average RNFL thickness is decreased from 104.1 micrometer in mild myopia to 76.3 micrometer in severe myopia. There is significant reduction where observed in all quadrant, which is more pronounced in temporal and inferior quadrant. Average RNFL thickness below 76 micrometer or a temporal RNFL thickness below 55 micrometer, which serves as a critical threshold to differentiate between myopic changes and the glaucomatous damages. Then by comparing the correlation between the axial length and the average RNFL, there is a strong inverse correlation was identified between axial length and the RNFL thickness. Comparing the correlation between disc area and the average RNFL, disc area enlargement correlate negatively with RNFL thickness. In my study, there is no statistically significant correlation was found between age and the RNFL thickness. Conclusion of my study: there is significant relationship between myopia severity and RNFL thickness, and RNFL thinning progresses with increasing myopia, especially in inferior and temporal quadrant. An average RNFL thickness below 76 micrometer or temporal RNFL thickness below 55 micrometer, which serves as a critical threshold to differentiate between myopic change and glaucomatous damage. Axial elongation emerges as a key factor influencing the RNFL thinning, reinforcing the biomechanical effect of myopia on retinal structure. Changes in optic disc morphology such as disc area enlargement are significantly associated with reduced RNFL thickness, emphasizing the need to consider the optic disc size when interpreting OCT measurement in myopic eyes. There is a weak correlation between age and the RNFL thickness within the study age group, suggests that myopia-driven structural changes are primarily due to refractive error and the axial length rather than age. Limitation of my study: there is a relatively small sample size, and the study only include participants aged 18 to 40 years, excluding the children and the older adults, which are also significantly affected by the myopia. Patients with peripapillary atrophy beyond 1.7 mm or prior ocular surgeries were excluded, potentially skewing the results towards the healthier myopic eyes. RNFL thinning is also observed in glaucoma, and glaucoma cannot be excluded in this study population based on HFA result. And RNFL thinning measurement might have been affected by the artifacts or calibration differences in high myopic eyes with tilted or deformed optic disc. And this study does not exclude other retinal layers such as ganglion cell layer, which are also affected by the myopia and could provide a complementary diagnostic insight. And this is the cross-sectional nature that prevents the longitudinal analysis, making it impossible to track RNFL changes over time or with progression of myopia. These are the references.
bringing in a disease, a condition like myopia causing RNFL defects, RNFL thinning, then it's a very good opportunity for you to compare between eyes. No, you can say in a myopia person of 7.5 in right eye, 7.5 in left eye, this much is the RNFL thickness. Or in certain patients where there is anisometropia, you can prove that one eye which at 7.5 had this much of thickness, one eye which is minus 0.5 had this much of thickness. So those things you are not exploring. That basically is very important when you're trying to put blame a condition on an anatomical eventuality. Yeah? Or else this will stand alone as something very anecdotal. You don't have corroboration here. You don't have proof that this exactly is the operant factor for this condition, this eventuality. Okay.
Just like sir said, in myopia, the disc can be tilted, right? So of course you're going to have temporal layers are going to be thinned out. That will show thinning on the GCC. That does not mean the vision or visual field defects are going to be there. So always correlate. Again, a person who's myopic can go ahead and develop a neurological disorder. So you need to follow up. And as sir said, just that isolated with OCT, progression myopia, how you're going to help the patient, I'm not very sure about it.
Something, just I'll ask one question only again. It's just it's a sort of conveying our, this should learn something from here also. You're told myopia. Can you tell me the meaning of the word myopia? You have presented so much OCT, ganglion, so many things you've told. Myopia, myopia, myopia. What do you, I'm not asking the definition of myopia. What is the word, literal meaning of the word myopia? You are myope, no? You are myope. What's your power? Minus
Minus
2. 2. You remove the glass now. Now look at us. Can you see? Suppose you want to see me without putting glass. Hello. Imagine now. You will do what? You will do what? Hey, don't put the glass, man. You will not, don't come towards us. You have to be there and try to see you. How to see? What will you do? Hello. Huh? You tell the answer now. Myopia means to close. Hello, to shut the eyes, shut the lids. That's the meaning of the word myopia, to shut or to close. Understand now? Because you are wearing glass, they said all tell us to let me see whether this girl is telling the answer or not. Let me ask you. You have to be very careful. Hello, basic should be strong. Okay, thank you.
You, Doctor.